so today I have the honor of speaking with Professor Yehuda Shoenfeld, head of Zabludowicz Center for Autoimmune Diseases at Sheba Medical Center. Professor Shoenfeld is a distinguished expert in the autoimmunity field. Welcome, Professor, and thank you for joining us, and thank you for your time. My first question, dear Professor, the discovery of autoimmunity took place in 1956, which was almost 70 years ago. And what do you consider to be the significant milestones in autoimmune research over the past decades?
Yes, actually, if we review this revelation 70 years ago, mainly by icon people like Noel Rose in the United States and Ivan Roth in England, there were two major issues which still now are completely or very important in the basic of understanding of autoimmunity. So the first issue is that you ask who is being attacked in our body, which cell, which molecule, which tissue. And if you know which antigen, and we will call it now autoantigen, is being attacked, and you can purify it and inject it into another animal model, mice, rat, rabbit, with adjuvant, you can induce autoantibodies in the animal model and imitate the autoimmune system. So this is one of the main rules, or the first rule, to demonstrate that a disease is autoimmune in nature. I will summarize it. To identify who is being attacked, the autoantigen, and the ability to immunize animal model with the autoantigen and to induce the human model in the mouse, rabbit, or rat. The second rule is that if you know who is being attacking you, which autoantibody is existing in the body, and you purify the antibody and transfer it passively to an animal model, rabbit, rat, or mouse, you can also imitate the disease. This is also shown in human being in the pregnant woman. If the pregnant woman suffers from an autoimmune disease and she has a defined autoantibody, anti-acetylcholine receptor antibody, or anti-platelets antibody, and she transfers passively the autoantibody via the placenta to the baby will be born with congenital hemolytic anemia, congenital thrombocytopenia, congenital myasthenia gravis. How long? For 3 weeks, until this autoantibody will be metabolized. So identifying the autoantigen, the ability to transfer by immunization the disease to the mouse, identifying the autoantibody, and the ability to transfer the disease, which is the ultimate evidence that the disease is autoimmune in nature. And the third point is the need for the adjuvant when you immunize the mice with the autoantigen.
Okay, thank you. And what do you think, what are the current trends of focus for scientists in autoimmune research? What are the current trends in the diagnosis and patient management of autoimmune disease? What can we expect in the coming years regarding autoimmunity?
So this was discussed extensively in the Congress of Autoimmunity in Ljubljana. There are several fields which are studied now to improve our knowledge of autoimmunity. Number one, new diseases. So, for instance, following the COVID-19, we were exposed to an avalanche of subjects with autoantibody disease, which we called post-COVID syndrome, which is actually chronic fatigue syndrome / fibromyalgia. So this is not completely new because we were aware of it with the EB virus, Epstein-Barr virus, and the chronic fatigue syndrome, etc. So this is in diagnosis. Why it is important? If you diagnose a disease as an autoimmune, you know how to treat it better. The second point is our knowledge or expanding our knowledge in new ways of therapy. We have seen the revolution of the biologics and the anti-cytokinic antibodies. They are looking for more antibodies, biological antibodies against cytokines to improve the disease. But there are additional aspects of therapy which we are looking forward, from bone marrow transplantation to small molecules. For instance, we have produced a molecule, a chemical molecule, that was produced from parasite, from helminths. And it was shown to be very similar to corticosteroids, but without the side effect of steroids. Mm-hmm. There is a trial to see if CAR-T may help in autoimmune disease. So it will be both in diagnosing new autoimmune diseases, as well as developing new methods of therapies in autoimmunity. Last but not least, most probably, early diagnosis and prediction will be developed quite rapidly because of the artificial intelligence, because of the use of big data, etc. And there will be a big question. Can we prevent autoimmune diseases? My belief is that if we know that an infectious agent can induce autoimmune disease, preventing the infection with the infectious agent can prevent the autoimmune disease or early eradication of the infectious agent. So it is diagnosis, therapy, and early diagnosis and prediction and prevention of autoimmune diseases.
Okay, and regarding this artificial intelligence in the so how do you see the role of AI in patient management, in patient diagnosis? How can we use AI?
AI, artificial intelligence, is at its, I would say, earlier steps. It will become better and better. And not only the artificial intelligence, but the way that everybody is using the artificial intelligence. It can be in a way of asking a better questions. It will be a way by improving the algorithms in which the artificial intelligence is based on. So I can assume, and I believe, that in the near future, artificial intelligence will be introduced, inserted, engulfed in our computer. So in every patient, automatically, we will get the response of artificial intelligence.
So we could say that the area of personalized medicine is coming.
Correct.
Yeah. And my last question regarding autoimmune diseases. So some scientists say that we are dealing with an epidemic of autoimmune disease. Do you agree with this statement? I know you mentioned the past COVID syndrome. So could you say what you think about it?
Absolutely, you are right in your question. In several countries like Germany and Colombia, there were already epidemiological studies which showed that following the COVID, which induced cytokine storm, so it stimulated the immune system very much, we are facing an epidemic or a significant increase in the incidence of autoimmune disease. The issue is, what is the incubation time between the infection and the emergence of the disease? And it seems like with EB virus, sometimes the incubation time is quite long. So already, as I mentioned, in 2 countries, they were able to show a significant increase in the incidence of post-COVID, but also of different autoimmune diseases. We have to remember that autoimmune diseases are induced in genetically prone people, which have genes, HLA, which make them to have a very strong immune system, which give them benefits in evolution as well in life. But when they are exposed to something which stimulates the immune system, it may induce in those people, like in young women, autoimmune diseases. Our modern life is flooded with all the factors which we know that can induce autoimmune diseases. Infections like the COVID-19, even EB virus was not eradicated. We don't have a vaccine against EB virus. Stress all over the world is now quite stressed by daily life, etc. We don't live in the nature with a river and trees and flowers, etc. Obesity, low vitamin D, high cholesterol diets. We are exposed to plastic. And there was now a paper in New England Journal of Medicine showing plastic nanoparticles in the plaques, in the atherosclerotic plaques. But we know that bisphenol, a compound which consists in plastic, may induce autoimmune diseases. Therefore, we should prefer to drink from glass water and not from plastic water. So as you can see, almost all the factors which were listed in our book, The Mosaic of Autoimmunity, they are more prevalent in our life. So it's not surprising that we are exposed and we may expect an increase in the incidence of autoimmune diseases.
Yes, you are right. Thank you for our conversation. Thank you for the interview. It was a pleasure. Thank you, Professor.
You won't believe that it was also my pleasure. Thank you very much.
Thank you.
Bye-bye.